Have a good day to everyone. Welcome and a celebration of the World Breastfeeding Week. Myself, Patel Archi, M.Sc second year students, Anand College of Nursing, Rajkot. It's my pleasure that I have an opportunity to talk about one very important aspect of the maternal and child health. Yes, today I am going to talk about the theme of the breastfeeding week of the 2020. The theme is to support a breastfeeding for the healthier planet. Breastfeeding Week is celebrated every 1st August to 7 August in a commemoration of the 1990 Innocent Declaration to improve the health of the babies around the world by the celebration. The week-long event also raised the awareness to community. Now, I would like to give us some basic introduction about the history of the breastfeeding week, a significance of the breastfeeding, a position, a techniques, benefits of the breastfeeding, then the statistic of the Gujarat infant mortality rate. So, let's begin with the history of the breastfeeding week. The World Breastfeeding Week is a global campaign to raise the awareness and the galvanize action on the theme related to breastfeeding. The World Breastfeeding Week first celebrated in the 1992 by the World Alliance for the Breastfeeding Action and is now observed in over 120 countries by the UNICEF. And it's begun with a meeting in the 1990. The WHO and the UNICEF created Innocent Declaration. The World Alliance for the Breastfeeding Action is responsible for the baby-friendly hospital initiative and so much more. The major some basic points that included in the Innocent Declaration are: the first point they included is to appoint a national breastfeeding coordinator and create a committee. The second point is to practice the 10 steps of the successful breastfeeding. The third point they are included is to implement all the articles of the International Code of Marketing of the Breast Milk Substitute. The fourth one and the last point they are included is the establish and the enforce law that protect the breastfeeding right of a working woman. Each year, the WABA designed a new theme and the slogan to represent the World Breastfeeding Week. The theme is meant to emphasize and bring awareness to a particular aspect of the breastfeeding. Now we are going to discuss about the significance of the Breastfeeding Week celebration. Why we are celebrated this week, what is the importance and the aim behind that. The World Breastfeeding Week celebration aims is to highlight the huge benefit that the breastfeeding can bring to the health and the welfare of the babies and the benefit to the maternal health, focusing on a good nutrition, poverty reduction and the food security. World Breastfeeding Week has the dual goal of improving the health of the babies and promoting, protecting and supporting the rights of the woman to a breastfeeding anywhere and at any time. So let's further discuss about the position of a breastfeeding. Here the 11 different breastfeeding position I will going to show you. The first one is the laid back breastfeeding position. This position is not only for a newborn babies but useful for the any age baby. Especially it is used if the baby struggles to latch on other hold. The second position is a cradle hold. It involves a mother sitting upright with the baby positioned on his side, baby head and the neck lying along a mother forearm, and the baby body against your stomach in a tummy to mummy position. The third position is a cross cradle hold. This looks similar to the cradle hold, but the mother arms switch role, so baby's body lies along a mother opposite forearm. The next position is a clutch position. In this position, as you seen in the picture, the mother sits with the baby resting along forearm. Baby body tucks alongside mother's side with a baby foot towards the back. The fifth position is the sideline position. It is a very comfortable and the ideal position for the relaxed night feed and the breastfeeding in a bed. It's a more comfortable if a mother had a cesarean section. The next position is the laid back for the cesarean section. It is a comfortable position after a cesarean section, and this baby body across a mother's shoulder will let mother comfortably without any weight or a pressure on a mother wound. 7. Upright koala hold position. In that position, a baby sits a standing mother thigh with the baby spine and the head upright as the baby feet. It is useful for the baby who is suffering from the reflux disorder and the ear infection. The next position is the dangle feeding. In this breastfeeding position involves a baby lying on his back while mother crunch over him on all four and dangle her nipple in his mouth. It is helpful in the condition like a mother having a mastitis and the blocked milk duct. The next position is the 7 is the sling position. This position need a little practice, but the breastfeeding baby in the sling can be a convenient home mother at outside the home. The next one is the 10th position is a double clutch position. It is a very useful for the twins baby. A mother can feed them in a tandem while having a mother hands relatively free. The next one and the last one position is the dancer hand position. In that position is used when the baby has a low muscle tone. We can say like a poor muscles growth. Baby like a premature baby or a baby with the Down syndrome, we can use this position. Okay, so it's all about the different 11 position which we can use for the breastfeeding, and how and when we have to use. It's all about the position. And now I further explore the topic about the breastfeeding technique. Especially primary mother need the help for the learning of the breastfeeding technique. Okay, so the different here important points for the breastfeeding technique. The first one, the mother should be in a comfortable and the relaxed physically and mentally. So the next point is the correct positioning of the mother and the baby. Here the correct position is for the baby should be either supported by the mother's forearm in a slight head elevated position and with the head, neck and the back in the straight line. Hold close to the mother with the trunk to trunk. The next point is the latching. It is a very important point for the successful breastfeeding, in that the baby chin touches the breast and the cheek touches the nipple. Baby will open the mouth in the rooting reflex and quickly move to the breast with the lower lip below the nipple. So the nipple and the most of the areola part goes into the baby mouth. The next important point for the breastfeeding technique is arouse the baby if the baby sleeps while the feeding. A gentle tap behind the ear or on the sole of the foot. Initially, it should be given a 1 to 2 hour interval breastfeeding. The duration of the feeding should be continue up till baby is satisfied. The most important thing is one breast should be emptied completely before starting the opposite breast. Why? So baby get the hind milk and the baby hunger can be satisfied. Next point is a burping. Burping should be done gently. Usually it is not unnecessary, but if a baby having a poor latching, so there may be chances to swallow the air, and we can remove that air by using the step burping. The next one is the after feeding. What we have to do? So after feeding, baby kept on the right side of the mother, make a baby dry and comfortable. The next and very important point is the EBF, exclusive breastfeeding. Now what it mean by exclusive? So exclusive, that means only and only breastfeeding can give not even a single drop of water is allowed up to the 6 month. After 6 months, we can give the complementary feeding. Breastfeeding can continue up to the 2 years or beyond that. It is a mother's choice. Mothers should be maintain hygiene to prevent the contamination of the breast milk. It's a very important thing. Now, have a once look on a Gujarat infant mortality rate. It is the directly or indirectly impact of the poor breastfeeding due to the lots of reasons. May 2020, government stated that the infant mortality rate in the Gujarat had come down by the 2 points as compared to the 2017. Infant mortality rate declared is 28, which was the 30 in 2017. In this improvement, the major role of the WABA, World Alliance for the Breastfeeding Action as well. Lastly, I rest my topic with the theme, whoever heard this audio, please aware the people around you and help to make a healthier planet by supporting the breastfeeding. Have a good day.